For my interview, I chose to interview a clinical psychologist named Dr. Tackett, Amy Tackett. She has her master's in forensic science and a PhD in forensic science. The reason why she got those specific degrees to go into counseling is because she enjoyed seeing how criminology, psychology, and sociology were intertwined. She's a telehealth doctor whose clientele ranges from the ages of 13 all the way up to over 65. She provides therapy and does interventions. She works from a home office instead of in a clinical setting. One of the things that she finds the most fulfilling about working in the industry is when she has clients that cancel their sessions, like when they graduate her program, because she feels like it's so beneficial to get to see how people have grown and changed and just how psychology has made their lives better. However, one thing that she finds super challenging about working in the industry is that insurance causes a lot of issues. Insurance is the reason why she went to telehealth doctoring after having her own private practice. When she was dealing with insurance issues, it made it to where she wasn't getting paid. And not only that, but because of insurance issues, a lot of people aren't seeking the help that they need, which makes the mental health industry even worse of a place to work. She also talked about how eventually she wants to work in the prison industry because they get paid better, but it doesn't provide the flexibility that she needs right now. She did her internship at a nonprofit, so that way she was able to set one up and was able to help endangered youth. She experiences addiction, eating disorders, anxiety, and OCD the most in her job. One thing that she used to do that she does not do anymore is couples therapy. She's not a Christian, and so her worldview is different than mine. However, one of the recommendations that she gave for me or any student that is pursuing a job in the field is that her reputation, or anybody's reputation that's going into this field, really matters. But if you dwell on too much how people see you, it'll end up working against you instead of in your favor. So to put the best foot forward. She also mentioned to not worry about what others think of you, but to dress for the job you want, not the job you have. So as a student, you should dress like you're in a professional setting, whereas if you're in a professional setting and you want to go into, I guess, conferences, then do more professional attire. But she said that's one of the things that she learned early on in her career, and that helped her get to where she is now, is she was always looking forward to putting her best foot forward and how she presented herself without worrying about how others saw her, so that way it wasn't over-consuming. The best reflection that I get from this is one of the main takeaways that I got from her interview was it's okay to not know exactly what job you want in the psychology field. There's a lot of opportunities, and as time goes on, it'll change. What you want to do might change, because she used to think that she would love working with couples, but as she worked with couples, she found out that she's always having to be the mediator. She's always the judge. And she did her best to resolve the issues, but by the time that she saw them again, there were a lot of other issues that have come up, and so she felt like it was one step forward, 2 steps back. Like, she wasn't making any progress, and it was just taxing on her. And so one of the best pieces of advice that she gave me during our conversation was, if you feel like something's starting to affect your mental health in a negative way, even if you care about the clientele and the patients and what you're doing as a job, maybe it's your time to take a step back and look for other options. That way you can still help people, but maybe it's the type of work that you're doing, the type of clientele that you have. Her favorite clienteles are still juvenile clients. She really does enjoy working with children and preparing them for a better future and a better tomorrow. She feels like that's something that she does well, whereas couples, for her, she thought she would enjoy, but after doing it for several years, she realized that that wasn't where her heart was. And so I think my biggest takeaway is that you have to have a good support system of people that know what it's like to do a job that's similar to yours. She talked about how she has several friends that she gets together with, and they're all counselors and therapists or work in the psychology industry, and they don't necessarily talk about work. They do things that are unrelated to their work, but it's nice to be around people that understand what it takes to do the job that you do, because if you don't have those types of people that are filling your cup up while you're constantly pouring into others, you're going to have burnout. And she said that that's something that she wished she would have known sooner. I really enjoyed talking to Dr. Tackett because I realized that her master's was easier than her undergrad because it focused on something that she enjoyed better. And my undergrad has been something that I've struggled with as a single mom. I am not the best at research paper and writing. It's not my passion. What my passion is talking to people and trying to figure out how they can live a more cohesive life, a more fulfilling life for them and for people around them. It's one of the main reasons why I am so involved in my church, and she really helped me realize that